77 days of the first time my son was bullied to the day he died. 77 days in between.
We want to turn now to a difficult but important conversation. It comes courtesy of A Different Cry. It's a series produced by our sister station in Atlanta, and it focuses on the alarmingly high rate of young Black children dying by suicide. Research shows that they're dying at twice the rate of their white peers. You can watch the entire series now at kgw.com/A Different Cry. Now, that series got us wondering about the extent, basically, of this problem locally. Like, does it translate to the Portland area? So we turned to the local suicide prevention agency, Lines for Life, and they said, yes, those same national statistics hold true here as well.
Yes, it's true. Age 10 to 24-year-olds, the second leading cause of death for Black young folks. The highest rising suicidal population in America right now. It's tragic.
That's Daryl Turpin, the Director of Equity and Cultural Engagement for Lines for Life. He and CEO Dwight Holton both talked with us about this and as to why this is happening for Black children. National conversations focus around, and this probably won't surprise you, racism, bullying, racist bullying, and trauma tied to violence. But Turpin also added this about kids specifically in Portland.
But we have to look at this systemically, right? We have to look at things like, what has been the impact of gentrification, for example? When you take a community and relocate, dislocate, what are the systemic protective factors that are built into neighborhoods that you are basically destroying? Or you're basically relocating. So when you got young people growing up in communities where protective factors have been destroyed, so you don't have a sense of neighborhood, no economic development, no business owners, poor schools. What are the consequences? What is the residual effect of that? And I think we're seeing that.
And they said it's because of mounting awareness, like what A Different Cry is creating, that agencies like Lines for Life are changing how they do what they do. Here's CEO Dwight Holton.
Mental wellness looks different in communities of color. I'll give you an example that Daryl shared with me early on. Just even the basic question of defining suicidality. If you ask a young Black man whether he is suicidal, he's almost certainly going to tell you no. But if you ask him if he cares if he lives or dies and says no, well, that's suicidality too.
Okay, so what is being done besides changing those nuances in important questions like that? Well, Lines for Life is doing prevention work, they say, by training staff in predominantly Black schools and churches to talk more about this and let kids and everyone know it's okay to ask for help. And they say the county is doing that work too. Then there are these resources. Lines for Life has a racial equity support line where Black Portlanders of any age can call to talk to Black trained staff about racism and that lived experience. That's 503-575-3764. There's also the Oregon Youth Line. Kids and teens can call that 877 number there, or they can text teen to teen to 839-863. And then, of course, there is the National Suicide Prevention Hotline. That's available too. It's 1-800-273-8255. And we do want to end this segment with a point that Holton wanted to make sure everyone takes away.
You guys are taking on really hard topics. And this is stuff that will be traumatic for people to watch. So I think it's really important to emphasize the hope here too. We know that for everyone who dies by suicide, there are 280 people who think seriously about it, but don't and find a way forward. And for those people who find that way forward, these are real hero stories, right? So it's really important to emphasize for folks that yes, this is a significant challenge. Yes, it's a challenge we need to lean into hard. We need to get to a place where people can deal with their mental health the same way you deal with a broken arm, right? We know it's busted. We're going to go get some help for it. There are people who can help. It's easy to get the help. That's where we need to get. But the reality is that hope is not just a kind of Hallmark card, platitude. Hope is an evidence-based strategy. So we can help by reaching out and providing hope for people, and we'll make a difference in people's lives and we'll save people's lives.